Hi everyone, welcome to CBT Skills Made Simpler. Today we're going to talk about problems and targets. Now we discuss targets or goals with the patient at assessment, but we more formally do problem and target sheet. Like this one, best to do it in the first session of treatment. So what we would do is we explain the rationale for doing this, that it helps us, but we've talked about the problems and targets before. It helps us to structure it up and to measure them to make sure that we're progressing towards them. So we would either invite the patient to say what they feel the main problem is, acknowledging we've talked about it before, or the therapist can have a go at describing it. So we want to make sure that the problem statement includes a statement or information about the patient's thoughts, feelings, physiological state, triggers and behaviour and the impact. It can be a bit hard to get all that in, so if we're reasonably close to that, that's good. So for example, if a patient had social anxiety, a statement might be, I feel anxious in social situations such as parties. That's associated with negative thoughts such as I'll make a fool of myself, and the anxiety leads to physical symptoms such as shaky hands and encourages me to avoid such situations. So that'd be a reasonable kind of statement. Then we measure it. So the measurement on the sheet, if we look at the bottom, is this problem upsets me or interferes with my normal activities. So I just show the patient the sheet on camera or in person, and we just get them to rate how much it's impacting on their life. Then we might have one big problem statement, or we might break it up into two or three. There's not a right or wrong answer around that. Try and do it as collaboratively as possible. And then for each problem statement, we're going to have a target. So we want to have a SMART target, specific, measurable, achievable, realistic, timely. So the targets are to be differentiated from the homework assignments that we do every week. This is something usually for the end of therapy. So I would say, I would ask the patient usually this: what would you like to achieve by the end of therapy in relation to the problem we've just talked about? So he'd say something, I'd shape it up into CBT language, make it a bit smarter. So potentially target for social anxiety would be something like, I will go into a social situation with my friends twice a week without safety behaviours, and I will fully interact in the conversation in a relaxed manner. Something like that. And we'd write that out. Doesn't matter whether the therapist writes it or the patient writes it. I normally would write it myself because it's quite a lot for them to be doing and thinking about. And then again, we would rate this. So it's a slightly different rating scale, and it can be a little bit confusing for some patients. But the scale is asking you how much you've achieved this at the moment. So the scale says, my progress towards achieving this target regularly without difficulty. No success, 25%, 50%, 75% complete success. So it's going to be at the top end, isn't it? So we do that. We use it in therapy. We have it on the table for reference. We make sure that we're progressing towards the targets. We can measure them periodically, and we'll measure them at the end. So it really structures your therapy up when you do this. So it's a great technique and should be done with all patients. Okay, thank you very much.